So we have only 26 units of platelet in Intermountain as of last night, and I'm not sure what's the root cause behind the shortage, but we're going to talk about platelets. So for education today on platelet, I want to do a little reminder of transfusion guidelines. So on a healthy baby who is doing well clinically, 20 no bleeding, 20,000 would be the threshold where we would want to consider giving a platelet. A patient who is more premature, who has an IVH, then the threshold would be higher, usually 40 to 50,000, where we would decide to give platelet. If a patient goes to surgery, that's going to be a discussion with the surgical team, but more in the 50 to 80 or even 100,000 if it's a pretty extensive case and they're concerned about the risk of bleeding. So there's a different way to look at transfusion guideline that just by platelet count is platelet mass. So platelet mass is the product, the number of thousands of platelet times the mean platelet volume, NPV, you'll see on your CBC. So the mean platelet volume is really what it means, the size, the average size. And so young platelets are large, older platelets are small. The younger, the larger they are, the more physiologically active they are, and the more they'll protect patient against bleeding on breaching gaps in any blood vessel. And so those cells come from the bone marrow, the megakaryocytes, and they are break-off of the cytosol of the, so there's no DNA in it, and they shrink over time. And when you are active bone marrow that produce lots of platelets, your mean will be around probably 10. If they are a little bit older, and it's pretty common to have a mean platelet volume around 8. On 8, it would be when we do that guideline for transfusion based on platelet mass, 20,000 or 160 mean platelet mass. The higher threshold would be around 400. But the important things to consider is that if you have a 20,000 platelets that are fairly small, 7, 8, you're going to be below that threshold of 160,000. But if you have young platelet that mean platelet volume of 10, then that platelet mass will be 200,000, where you're not transfused. And the reason because they're more physiologically active and protective to the patient.
Low cutoff is 160, you said?
160.
For the mean platelet volume.
Yes. So the other thing I wanted to talk about is the different type of blood product. Platelet are the only blood product who are not refrigerated. They kept at room temperature, and they are kept for a number of weeks. Blood is refrigerated, and plasma is frozen. And so this what's required to maintain the quality of the physiologic activity of the blood products. However, because they are not refrigerated, platelets are the least clean of all blood products. If there was any problem during the processing of it, then you increase your risk of infection. It is known that a patient who receives a lot of platelet transfusion will be at risk of higher risk of sepsis, including fungal sepsis. And so that's something important to understand. What else did we talk about earlier?
We talked about Neupogen.
Okay, so when we talk about transfusion, it's like we have different ways to stimulate the bone marrow. White blood cell can be stimulated by Neupogen, and this is the better way to manage neutropenia. We cannot transfuse white blood cell. You've never seen that. There's few reasons. One, this is immune active blood product, the cells, that would have to be typed for the patient, like HLA typing, and the half-life is